again, I think maybe we're dispelling some misconceptions about EMDR, but it does have this reputation sometimes of being this kind of therapy where the therapist lets a process happen. It's about this bilateral stimulation, and client is just processing. And there is something very cool about how much people can do when it's set up properly. But I'm also curious to hear your thoughts on the therapist's role. Let me make it more specific. The therapist's role when we're doing this processing that really can be quite internal.
hmm hmm Yeah, I think it starts in those preparatory phases where we're building a
Hmm.
relationship, and then where during the reprocessing, the vast majority of clients choose to do reprocessing, in my experience at least, by and closing their eyes so they
Mm.
don't see me,
Yeah,
but they feel me,
yeah,
I think.
yeah.
And that means something, right? It means something. And it is true that during that reprocessing, mostly what you will hear me saying is literally, it's very brief. It's literally what came up,
Hmm.
go with that. That's it. And
Yeah.
that is, in the beginning, that might seem weird or sound disconnected. But it really isn't. It really isn't. The purpose of dipping in like that every now and then during the reprocessing is for me to know that the client is still here in the present and not in a flashback or something very distressing.
Hmm.
I also gauge that by observing them, and it helps them know that too, because every now and then they'll hear me and my voice. And then again, at the end of a session or at the end of the full treatment, we're always closing out by processing a little bit what happened.
Hmm.
Not too much, because we're not trying to go into it again if we're ending the session, but um reconnect, coming together again more fully, I guess, compared to during the reprocessing.
Hmm.
Does that answer the question? Is that the question that
Yeah.
you
Yeah,
asked?
yeah,
Or
yeah.
yeah.
Yeah, I think what I'm hearing is the work that you do beforehand lets the clients begin to sense your presence, and you can refer back to it while they're processing
Yeah.
with your voice, with just how you are in the room with them, and
Yeah.
that is grounding, I
Yeah.
think, for people.
Yeah.
Helps keep
Yeah.
them safe. It reminds them that even though they're doing this internal process, they're not
Yeah.
alone.
Exactly. And also part of the preparatory work is to make sure that the client knows that they are completely in control. If they need to stop, if they wanna pause, if they wanna ask me something, I'm here, and
Mhm.
that to just trust themselves in that way also, which is very often part of what we're building, right? Is an increased trust in yourself, that you can take care of yourself, that you are safe. Yeah.